The 21st century has witnessed a disturbing trend, the resurgence of infectious diseases. Once thought to be conquered by medical science, these microscopic foes are staging a comeback, armed with a new and potent weapon: antibiotic resistance. This phenomenon, where bacteria evolved to withstand the drugs designed to kill them, poses a grave threat to global health. Among the infections affected are sexually transmitted infections, or STIs, adding another layer of complexity to the fight against these often silent threats. We live in an age where intimacy is celebrated and sexual health is paramount. Yet the specter of untreatable STIs looms large, fueled by the rise of antibiotic resistance. This convergence of factors has created a perfect storm, jeopardizing decades of progress in controlling infectious diseases. We are on the precipice of a new era, one where common infections could once again become deadly. The urgency of this situation cannot be overstated. Antibiotic resistance is not just a medical problem, it is a societal problem. It affects everyone, regardless of age, gender, or socioeconomic status. We must act now to preserve the efficacy of antibiotics and protect ourselves from the looming threat of untreatable infections. The time to act is now. Our health and the health of future generations depend on it. Antibiotics, the miracle drugs of the 20th century, revolutionized medicine and saved countless lives. These powerful agents work by targeting specific mechanisms within bacteria, effectively killing them or halting their growth. However, bacteria, like all living organisms, are constantly evolving. In the relentless struggle for survival, they have developed ingenious ways to resist the effects of antibiotics. Antibiotic resistance develops through a process of natural selection. When antibiotics are used, susceptible bacteria are killed, leaving behind a small population of resistant strains. These resistant bacteria then have the opportunity to multiply and spread, passing on their resistance genes to their offspring. Over time, this can lead to the emergence of bacterial populations that are highly resistant to multiple antibiotics. This resistance can manifest itself in various ways. Some bacteria develop enzymes that break down the antibiotic molecules. Others alter their cell walls to prevent antibiotics from entering. Still, others develop pumps that actively remove the antibiotic from their cells. These mechanisms, honed over millennia of evolution, make bacteria formidable adversaries in the fight against infectious diseases. The rise of antibiotic resistance has profound implications for the control and treatment of sexually transmitted infections, or STIs. STIs, which affect millions worldwide, are typically caused by bacteria, viruses, or parasites transmitted through sexual contact. Antibiotics, particularly those targeting bacteria, have been the cornerstone of STI treatment for decades. However, the emergence of drug-resistant strains threatens to undermine these advances. Gonorrhea, chlamydia, and syphilis, some of the most common STIs, are now showing increasing resistance to the antibiotics traditionally used to treat them. This resistance makes treatment more challenging, increasing the risk of complications and onward transmission. Untreated or inadequately treated STIs can lead to severe health consequences, including pelvic inflammatory disease, infertility, ectopic pregnancy, and an increased risk of HIV transmission. The intimate nature of sexual contact facilitates the spread of antibiotic-resistant bacteria. As resistant strains circulate within sexual networks, they become more challenging to control. This underscores the importance of prompt testing, treatment, and partner notification to break the chain of transmission. The World Health Organization, or WHO, has identified antibiotic resistance as one of the biggest threats to global health, food security, and development today. STIs are not immune to this threat. In fact, they are at the forefront of this emerging crisis. Statistics paint a grim picture of the scale and severity of the problem. According to the WHO, over 130 million new cases of gonorrhea occur annually, with a significant proportion showing resistance to the antibiotic ciprofloxacin. Similarly, resistance to azithromycin, a common treatment for chlamydia, is on the rise. Syphilis, once easily treatable with penicillin, is also witnessing the emergence of resistant strains. The emergence of multi-drug resistant gonorrhea, resistant to almost all available antibiotics, has been reported in several countries. This alarming trend raises the specter of untreatable gonorrhea, a scenario with potentially devastating consequences for sexual and reproductive health. Section 5, Public Health Under Siege, the consequences of untreated STIs. The rise of antibiotic-resistant STIs poses a significant threat to public health. Untreated or poorly treated STIs can lead to a cascade of health problems, both for individuals and the wider community. The consequences extend far beyond the immediate discomfort and inconvenience of an STI, potentially impacting fertility, pregnancy outcomes, and overall well-being. One of the most serious complications of untreated STIs is pelvic inflammatory disease, also known as PID. PID occurs when an infection spreads from the cervix to the uterus, fallopian tubes, or ovaries. It can cause chronic pelvic pain, infertility, and ectopic pregnancy, a life-threatening condition where the fertilized egg implants outside the uterus. Moreover, some STIs, such as syphilis, can have long-term systemic effects if left untreated. Syphilis can damage the heart, brain, and other organs, leading to serious health problems years after the initial infection. The resurgence of syphilis in recent years, coupled with the emergence of resistant strains, is a cause for serious concern. Section 6. Tracing the roots causes of antibiotic resistance in STIs. The emergence and spread of antibiotic resistance are complex phenomena driven by a multitude of factors. Understanding these factors is crucial for developing effective strategies to combat resistance and preserve the efficacy of antibiotics for future generations. While the mechanisms of resistance are rooted in the biological world, the drivers of this crisis are largely anthropogenic. One of the primary drivers of antibiotic resistance is the overuse and misuse of antibiotics. Overprescribing antibiotics, often for viral infections that do not respond to these drugs, fuels the development of resistance. Similarly, using antibiotics inappropriately, such as not completing the full course of treatment, creates ideal conditions for resistant bacteria to thrive. Another contributing factor is the lack of new antibiotic development. Pharmaceutical companies have been slow to develop new antibiotics, primarily due to economic considerations. Developing new drugs is a costly and time-consuming process, and the return on investment for antibiotics is often perceived as low compared to other classes of drugs. Section 7. Turning the tide combating antibiotic resistance. The fight against antibiotic resistance is a multifaceted challenge that requires a comprehensive and coordinated approach. Addressing this global health threat demands a concerted effort from governments, healthcare providers, pharmaceutical companies, and individuals alike. Only through a collective effort can we hope to preserve the efficacy of these life-saving drugs. One crucial strategy is to optimize the use of existing antibiotics. This involves promoting responsible prescribing practices, encouraging patients to adhere to prescribed treatment regimens, and reducing unnecessary antibiotic use in agriculture. Antibiotic stewardship programs, which aim to guide and monitor antibiotic use, are essential in healthcare settings. Another essential approach is to invest in the development of new antibiotics, vaccines, and alternative therapies. Government incentives and public-private partnerships can encourage pharmaceutical companies to prioritize research in this area. Furthermore, exploring innovative approaches such as phage therapy and antimicrobial peptides holds promise for the future. Section 8. Personal responsibility, protecting yourself and others. While addressing the systemic drivers of antibiotic resistance is crucial, individuals also play a vital role in combating this global health threat. By making informed choices and adopting responsible practices, we can all contribute to the fight against antibiotic resistance and protect ourselves and our communities. One of the most effective ways to prevent STIs, including those caused by antibiotic-resistant bacteria, is to practice safe sex. This includes using condoms consistently and correctly, limiting the number of sexual partners, and getting tested regularly for STIs. Open communication with partners about sexual health is essential. It is crucial to remember that antibiotics are not effective against viral infections, such as the common cold or flu. Taking antibiotics unnecessarily will not cure these infections, and may even contribute to the development of antibiotic resistance. If you are unsure whether you need antibiotics, always consult a healthcare professional. Section 9. A call to action, safeguarding our future. The rise of antibiotic resistance is a stark reminder of the interconnectedness of human health and the microbial world. It serves as a potent call to action, urging us to reevaluate our relationship with antibiotics and adopt a more sustainable approach to healthcare. The choices we make today will determine the health of future generations. We must recognize that antibiotic resistance is not just a medical problem, it is a societal problem that demands a collective response. It requires a fundamental shift in mindset, from a focus on individual treatment to a broader perspective that encompasses public health, environmental stewardship, and global cooperation. The time to act is now. We must work together to preserve the efficacy of antibiotics, prevent the spread of resistant infections, and safeguard the health of our planet. By embracing a One Health approach that recognizes the interconnectedness of human, animal, and environmental health, we can create a healthier and more sustainable future for all.